Well, welcome back for another video. Today we're going to be talking about a really important topic, and that is, what are the symptoms that babies get if they get coronavirus infection or COVID-19? Let's get to it. So if you're new to this channel, welcome. I'm Dr. Ford, and I'm a neonatologist and a pediatrician. Here we talk about everything babies, all the way from preemies to 1-year-olds, from a medical perspective and from a parent perspective. So if that's something that's interesting to you, go ahead and subscribe, hit like to those videos if you like them, and hit that notification button. That way you'll know as soon as I post something. Alright, that's out of the way, let's get to the video. So coronavirus infection, this pandemic has hit everybody, from a social standpoint and from a medical standpoint. And obviously, since December, we've been gathering a lot of data and information on how this virus affects adults. Recently, we're beginning to see some of these symptoms and how it affects some of the pediatric patients, but there's really very little known about babies. There's a little bit coming out from the transmission, and if you're interested in that, I'm going to go ahead and put a link. We're going to be doing another video on the transmission of coronavirus infection to babies. But specifically today, we're going to be talking about the symptoms of babies if they get coronavirus, if they get COVID-19. So there's not a lot known on what are the symptoms for babies. Luckily, the symptoms that pediatric patients get as opposed to the adults is a lot milder, and less even so for the babies. And so there's not a lot of information on that. There was a recent study that came out of France that looked at 6 different babies, 5 of them being less than 1 month of age, and 1 of them less than 2 months of age. Of all the symptoms, the one that was in all of the 6 babies was fever. And that's a temperature of more than 38 degrees Celsius or 100.4 degrees Fahrenheit. Some of the other symptoms that they presented with were grunting or noisy breathing, breathing fast or tachypnea, some rhinorrhea or runny nose. They also had gastrointestinal symptoms such as vomiting, not wanting to eat much, or diarrhea. And some of them just had general malaise, which is a feeling of not really feeling great. And that's really hard to interpret in the baby, but they're just not themselves. And then just fatigue, just feeling tired, not being active, their usual active sets. So all baby patients are tested with a nasopharyngeal swab. What that is getting a small sample of the fluid inside of your nose and sending it for an RT-PCR or reverse transcriptase polymerase chain reaction. Now, in some studies, they've actually shown that half of the patients that are tested the first time can come back negative, meaning they don't see the virus even though it's actually there. That's called a false negative. And so you do want to do a confirmatory study, meaning you get a second sample, a second test, to make sure. If both of them are negative, then it's really likely that it's a real negative, that the virus is not there. But obviously, sometimes you get the first negative one, and then you get the real positive second one. So it's important to test that. Now, why is it that these babies present with these symptoms? To be able to answer that, you want to understand the actual virus itself. Now, let's talk about coronavirus. So coronavirus is a single-stranded RNA virus. So coronavirus is a single-stranded RNA virus. It is spherical in shape with spikes, and at the end there is an S protein. They enter the body through different cell types, but they do so through a molecule called ACE2, or angiotensin converting enzyme. When they attach to this, they're able to then enter the organism. And they can do this in different cells. One of them is the pneumocyte type 2 cell, pneumocyte being the cell of the lung. And this pneumocyte normally produces a substance called surfactant. Surfactant is a bubbly substance that lines the walls of your alveoli, which are basically your air sacs in the lungs. And this allows for the lungs to stay open so that they don't collapse. And so you can imagine that the actual virus entering through and causing problems with the pneumocyte type 2 can also affect the lung from that standpoint. But guess where you can also find ACE2? Yes, you got it. You can find it in the other parts of the gastrointestinal tract, meaning you find it in the esophagus, which is the food pipe, you find it in the intestines and all the way down to the colon. So this is why it's been shown to, for folks that have coronavirus infection, it's been shown to also cause this nausea, vomiting, basically inflammation of the gastrointestinal tract. When you look at lab abnormalities, they really haven't shown any difference in the labs. The smaller studies have shown possibly that some of the fighting cells called lymphocytes may be affected by it, but other studies really haven't shown a difference at all. As opposed to the older population, the older kids and the adults, they have seen some changes with your liver enzymes. There have been some changes with your platelets and some of your other white blood cells. But that hasn't been shown in the newborn babies. That hasn't been shown in the babies at all. So that's kind of interesting. When you look at the chest x-ray, you can see alveolar interstitial syndrome. Basically what that means is that the alveoli, meaning the actual air sacs, and the tissue in between the air sacs are affected. They could be affected by inflammation, irritation, and thickening. You can also have some debris deposit there. And you can imagine all this inflammation and debris that's deposited, all the cells that are trying to fight that infection can cause breathing problems. And that's why some of the patients present with hypoxemia, meaning their oxygen level is a little bit lower than they should be normally, which is over 93% in regular, full-term babies. So the great news is that when babies get infected, the prognosis or how they do after that is actually excellent. Most studies, and again, there are only small numbers, really show that they have mild symptoms, if any. Most babies don't require any oxygen. Most babies actually are able to feed by themselves. They don't need a feeding tube or anything. And they really usually get admitted to the hospital only for observation of 1 or 2 days. Now, that's a little bit different with newborns. I will be doing another video looking at the transmission of maternal to baby to newborn coronavirus, or the moms had coronavirus during the pregnancy, what happened to the babies. But even in those babies, there really is only a 1% chance that the babies actually got sick. And please, I'm going to go ahead and post that link to the video when I create it, so that you can follow up on what happens with the transmission and what happens to those babies that are born, how many get admitted to the intensive care unit, so on and so forth. So you'll be able to get more details when I create that video. But as of now, there really hasn't been anything major, any major complications from coronavirus in babies. So what should you do if your baby presents with some of these symptoms? Because they can have that from any other viruses or just having a bad day. They have ate something that just didn't sit well with their stomach. So the first thing you want to do is definitely call your pediatrician. Let them know that your baby's having these symptoms. There may be a background that they may know better and would like to see the patient because of their background, or they might have another disease that could complicate things. But if you look at most experts, most infectious disease experts do not recommend you immediately take your baby into the emergency room or the hospital if they're having these symptoms. Now, the one thing is if they're having respiratory problems, if they're breathing hard and fast, if they're changing their skin color, you see them change blue, their lips are changing blue, their chest or face is changing color, you immediately call 911 or you go to the emergency room, make sure your baby's oxygen level is safe. But if you're having some of the other mild symptoms, call your pediatrician first, let them know what's going on, and then they can go ahead and decide whether you need to go to be seen or not. But it doesn't need to be an immediate emergency admission or emergency visit if you're not having the respiratory problems. All right, so again, we've gone over some of the symptoms that you can see in babies that have coronavirus infection. The number one thing is fever. That means a temperature of more than 38 degrees Celsius, 100.4. If you see that, definitely let your pediatrician know. That's extremely important. That's basically the main symptom that you see. And then you can see some other symptoms that you can go back in the video, look at what I talked about, some of the other symptoms that they can have. Any respiratory problems, you call your pediatrician immediately, 911, or you may need to go to the emergency room if your child is really struggling to breathe or having any problems like that, okay? So having said all that, again, thank you so much for watching. I will be adding more videos regarding coronavirus and babies of different presentations, being born with a mother who has coronavirus, and some other videos. So please follow the series. Again, if you like this video, hit like, hit notify so you can get a notification as soon as I post a video. And please, if you haven't done so, go ahead and subscribe. You can look at my other videos. And again, thank you for watching, and we'll see you with the next video.